cold, so it might as well be really nice.
Yep. Looks like Thomas turned on the camera.
I did turn on the recording. I'm trying to start the YouTube live stream right now.
Okay.
I'll go on mute until you need me. Really nice.
Yep. Looks like Thomas turned on. We may have some audio issues that we need to work through before we jump in. Reverb.
Casey is on her way. Thomas, you let us know when you're ready. Looks like Casey has joined. We have all other board members and presenters. Sandra is here. Good morning.
Okay, could you see my screen?
Can you hear me? We did, but it's gone now.
All right, how about now?
Yes.
Okay, sorry, my internet blinked out right at 10 o'clock, which was poor timing. So, but we are back, and we should be recording and live streaming. So we.
Do you have them? See, Chelsea, there may be in there may be some white ones. Mm-hmm.
Are we ready to begin?
Yes.
Okay, I will call the meeting to order and announce that all of the requirements for the Open Meeting Act have been met. I would also like to announce that if this meeting is disconnected, the meeting will recess and reconvene after reconnection. And if we cannot become reconnected within 30 minutes, this regular meeting will be reconvened on Tuesday, April 6th at 10 a.m. I would also like to remind everyone that this is a virtual meeting, but we will observe all the rules of decorum of a regular in-person meeting. I'd like to welcome everybody joining us through Zoom or through our YouTube live stream. It's good to have community support and people joining us that way. I'll ask the board members now if they've had time to review the minutes from our February meeting, and then I will ask for a motion to approve the minutes from the February 19th special meeting.
So moved.
Second.
Motion has been made by Jack Allen and seconded by Bruce. Please call the roll.
Michelle Stevens,
Yes.
Bruce Benjamin,
Yes.
Jack Allen,
Yes.
Casey Kilblane,
Yes.
Susanna Gattoni,
Yes.
Marshall Snipes.
Yes.
All
Motion
right.
passes.
I guess we're ready now for Julie to give us the executive director's report. Julie?
Yes, good morning. Good morning. One of the things that we have done in the last couple of board meetings is take a look at the strategic goals on the TSET strategic map. And today we're going to look under the operations pillar at the goal to review future funding strategies. This has been ongoing work for the past fiscal year as we are streamlining our budget planning process for the next fiscal year and beyond. In this meeting, we will be sharing with you a draft budget for discussion and feedback, and we'll bring a final budget for approval in May. This discussion today represents the work of ongoing planning for growth, new programs, and investments in TSET infrastructure. You will see this draft budget and we'll take any feedback, but this comes after a 2.5% decrease in the FY budget after our anticipated earnings in FY20 took a dip, as most investments did with the stock market. It is noted that we do not use previous year earnings for budget, but it does give us an indication of available cash. And so we have brought you a draft budget to get your feedback. And this is also highlighting how we are working to streamline and always process refinement with our planning processes. Any questions or comments on that?
No.
All right. I can also do the overview of executive director activities. We've made progress towards advancing on our plan for data analysis and a data management plan within the agency. TSET will have a data scientist intern from OSU working with staff lead Lance Thomas this summer on assessing what we have, what we could use, and what types of questions we could be asking the information that we have to provide analysis for planning and future programming. I have participated in a national webinar series hosted by the Action on Smoking and Health as one of 4 panelists with the Truth Initiative and Campaign for Tobacco-Free Kids. The webinar focused on educating the public and lawmakers about tobacco industry interference in policy and government. In addition, we are participating in a segment of the verdict, taping for those that have that on their Cox cable, as well as ongoing meetings with state agency directors to discuss shared goals, educate on the programs that TSET has, look for points of leverage and synergy, and at the same time, always meeting with lawmakers to answer any questions or provide an overview of our work. And also, just to highlight, a recent national report shows that tobacco helplines across the nation are down as people continue to struggle with stress and increased mental health needs. Even as in this challenging environment, our numbers to the Oklahoma Tobacco Helpline continue to see higher call volumes than peer states. We are also noticing a dip in referrals to the helpline through our health systems grants compared to the previous year. some of the things there is that you're seeing fewer people coming to the doctor, fewer people going into a health system for a preventative or consultation. And so we'll be continuing to look at this and are encouraged with the vaccination uptake and hope to see patient numbers and referrals increase for the remainder of this fiscal year. And also later in this meeting, you will get an update on the TSET Food Systems Impact Grant. They've reached about their halfway point, and I've had an opportunity to visit with all of them, so we can look forward to those outcomes later on in the meeting.
Thank you, Julie. Now we will go to the Agency Operations Committee report, and Marshall, will you take that for us, please?
Yes, thank you, Michelle. As Julie just mentioned, we're going to be talking about the budget here in a second. But first, we did get an update on our 6-month earnings estimate, which is the basis for our budget for next year. And I'm happy to report that we had a significant increase in our earnings over the first 6 months because of the way that's calculated, dividends, interest, and realized gains. Unless we had some catastrophic realized loss in the second half of the year, we will have enough money in the current earnings to be able to increase the budget back to where it was in 2019 going forward. So that's all good news. And we are now getting more information out of the Board of Investors to be able to kind of look forward and use that as a guidepost for the budget for this year. So that's all good news. Obviously, that means we're not going to have any downward pressure on the budget this year like we did last year. So moving on to the financial reports in your packet, you can see that the operating budget for the current year is right on target at a 53% spend rate. That's good news. The program budget is behind a little bit. We're only at 40%, and our management's working with the grantees that have fallen behind in either the timing of invoicing or actually not spending as much money as we allocated to them. So that could require some budget revisions later in the year, which would be downward budget revisions. In the operating budget, there's some revisions. They're pretty minor. You can see those in your packet. Some travel expenses that didn't get spent, some office furniture that didn't get purchased. Those are minor amounts that total $20,000 reduction in the operating budget. In the program budget, we also have some, revisions. We didn't travel like we anticipated, so that will go down. And then there's some grant review money that didn't get spent that will also reduce the budget. And then we approved the ODOT money last board meeting, where we were moving it from innovation to a separate line. So that's really not an overall change in the budget. It's just a reclassification of the money we approved last time. We are also asking for a $25,000 reduction in the OSDH contract was reduced by $25,000, and we're increasing the amount of the on-site partners technical assistance contract. And that information about on-site is in your packet as well, if anybody has any questions about that. Now, that brings us to the budget that we'll be approving in the next board meeting, but we wanted to go ahead and give you a peek at that budget in this board meeting and give you plenty of time to respond to the changes. In your board packet, there is a copy of the budget that will be proposed in the May board meeting. There could be some tweaks to that based on what we discussed today. But generally, you can see it's a $49.9 million budget for fiscal year 21. That's a 6.5% increase. And as we said earlier, that puts us back to the fiscal year 2019 levels. As you know, we reduced the budget last year because of earnings pressures, and we're able to restore that this year. So that's good news. You can see in the comments section of the budget what all those changes from the prior year are. I think the biggest budget was the Healthy Living Program 2.0. We're ramping that up to 9 million from the 6.7 million, and we'll have plenty of time to discuss what that means in our next board meeting. And then you can see all the other restoring the research contracts to their previous amounts and doing some other things that you can see there in the budget. But I'll pause there. And are there any questions about the proposed budget? I assume everybody's had a chance to look at it. And if you have any questions about it or comments, now would be the time to do that. We will have plenty of time to get into the details of this in our next board meeting. So with that, Michelle, that concludes my report.
Thank you, Marshall. We'll now turn it over to Jonas, our Director of Programs, and he will introduce our speakers for today prior to each presentation. And the summaries on each of the research programs are in your packet if you care to join.
Yes, so Doctors Michael Bushnell and Darla Kensor with the TSET Health Promotions Research Center are going to be presenting first. And Dr. Bushnell is a Peggy and Charles Stevenson Endowed Chair in Cancer. He's Associate Professor, Department of Family and Preventive Medicine. Of course, he's the co-director of the Research Center, and he's the director of the mHealth Shared Resource. Dr. Kensor is an associate professor with the Department of Family and Preventive Medicine. She's the co-director of the Research Center. She's the co-leader on the Cancer Prevention and Control Program and director of the Hprc Tobacco Treatment Research Program. Dr. Bushnell and Dr. Kensor.
Thank you very much for having us here today. I am going to do my best to briefly answer the questions from TSET that were given to us, and I'm happy to take any additional questions that arise. So the first question that was asked of us was regarding return on investment of funds, and then specifically about the number of researchers that have been recruited to Oklahoma in fiscal year 20 and their areas of interest. So I'll just start with that. So we have recently hired 3 new tenure track faculty. Each of them started in August 2020. So that's Dr. Ton Bowie, Dr. Adam Alexander, and Dr. Julia McCoy. So Dr. Bowie's research focuses on tobacco cessation interventions for people living with HIV and other populations, as well as HPV vaccination promotion. Dr. Alexander's research focuses on characterizing social and environmental influences on health among African Americans, and then also health promotion interventions in this population. And then Dr. Julia McCoy, she came to us from University of California, San Francisco. Her research emphasizes health geography and qualitative and mixed methods approaches to understanding relationships between the environment and rural health behaviors and substance use. And then we've had 2 of our newest faculty recruits, Dr. Amanda Kong and Dr. Jordan Neal. They've just accepted, they haven't started yet. Dr. Amanda Kong is coming from the University of North Carolina. Her research focuses on health geography, spatial methodology, tobacco control policy, and health disparities. She is going to join us in July this summer. Dr. Jordan Neal is coming from Harvard Medical School. He should be joining us actually in April, so just in the coming weeks. His research focuses on cancer risk reduction, health disparities, cancer screening and prevention, health communications, and digital health. And then since we recorded our slide presentation, we have had another faculty member accept an offer from our center, Dr. Desiree Azizodin from Harvard Medical School. Her work will complement the work of the rest of the faculty here. It focuses on technology-based interventions for pain management, including the management of opioid pain medication use. We have one additional offer out to a researcher from Duke University. We are expecting him to accept in the next week or two, pending a job offer for his wife. So in addition to all of our new faculty recruits, we've really focused on growing our faculty affiliate program. So now that includes more than 35 researchers who support the HPRC mission across the state of Oklahoma. In our recorded presentation, we highlighted the work of Dr. Lourdes Camado and Dr. Sydney Martinez. So the second question was around how the TSET funds have been leveraged to obtain additional research dollars. So since 2016, TSET support to the HPRC has resulted in over $56 million in additional grant funding to HPRC investigators. So for every dollar that TSET has granted to the HPRC over the past 5 years, an additional $2.56 in external grant funding has been awarded to our faculty and our affiliates. In fact, we've had a good fall and spring here. We expect to receive 3 additional multi-million-dollar mobile health intervention grants from the NIH beginning just probably tomorrow in April, actually. So we're very excited about that. So in our recorded presentation, we presented a table that listed 17 ongoing NIH grants to HPRC faculty. Most of these grants focus on tobacco and tobacco cessation and vulnerable populations, including low-income smokers, pregnant smokers, racial ethnic minorities. We have at least as many pilot research studies ongoing, funded both by our center and then also from other organizations, including the American Cancer Society, Pfizer, the Stevenson Cancer Center, and the Ham Center. These pilot studies are designed to lead to future grant applications that would bring in NIH funding and funding from other national sources. So in addition, the HPRC employs more than 50 Oklahomans to support more than 30 ongoing research studies. We are a key component of the NCI designated Stevenson Cancer Center. Our faculty's research is regularly presented in the media, bringing needed attention to health issues and health disparities relevant to Oklahomans. HPRC faculty are leaders and advocates at the national level through their service roles at the NIH and public health organizations. So in terms of our journal articles published and how those articles may have influenced best medical practice, the HPRC faculty have published 62 peer-reviewed scientific papers in FY 20 and 21. We expect this number to increase because we're bringing new faculty on board and growing our center. Many of these publications have impacted public health research and practice. We highlighted several in our recorded presentation, and given time constraints, I'll just summarize by saying that the published work of HPRC investigators has focused on a broad range of issues, including the development and evaluation of widely disseminable smartphone-based interventions for tobacco cessation and other health behaviors, understanding the impact of e-cigarette use on response to chemotherapy, and understanding the appeal and addiction potential of menthol to inform FDA regulation. These are just a few of the papers that we published. In terms of community-based collaborative efforts within our center, the HPRC partners with community organizations to conduct research and improve public health in multiple populations. We've been working with the Homeless Alliance for the past several years to understand and address health risk factors among adults experiencing homelessness. We're working with the Regional Food Bank and Department of Mental Health to recruit socioeconomically disadvantaged individuals into trials to evaluate tobacco cessation interventions specifically for these populations. We have numerous other community partners, which we've listed in our recorded presentation, including the Choctaw Nation, Ebenezer Baptist Church, the Oklahoma Tobacco Helpline, and many others. All right, in terms of the number of persons assisted by research interventions in the TTRP and our other research projects, in FY 20 and 21, we enrolled a total of more than 3,600 Oklahomans in our research studies, including smoking cessation intervention trials. And our research has focused on a variety of topics, including understanding the health effects of e-cigarettes, menthol flavor appeal, cannabis use, and cancer survivorship. And I hope I've stayed within the 5 minutes. Thank you very much.
Thank you, Dr. Kanzer. Do we have any questions for Dr. Kanzer?
And
Okay.
these presentations, all of them, each grantee did a recorded presentation. They are on our website. If you want, or members of the public want to see, it is available on our website.
We'll move on to the Oklahoma Center for Adult Stem Cell Research, and Dr. Courtney Griffin will be presenting. She's a member of the Cardiovascular Biology Research Program, Scott Zerl Chair in Biomedical Research, and she's with the Oklahoma Medical Research Foundation. Dr. Griffin.
Thank you. I appreciate the opportunity to speak to you all today about OCASCR, the Oklahoma Center for Adult Stem Cell Research. So OCASCR, as many of you know, was initiated with TSET support in 2010 to address the rapidly expanding field of adult stem cell research. And adult stem cells are specialized cells, and they have the ability to become a variety of different cell types in our body. And we find that this area of research is exciting because our organs and tissues do become damaged by various diseases, including ones associated with smoking and obesity. But if we can replace these damaged tissues with fresh ones made from stem cells, we have the potential to cure or alleviate a number of diseases that impact Oklahomans and other people around the world. So in 2018, we expanded OCASCR's focus to also include the field of regenerative medicine. This refers to an area of research that broadly focuses on fixing or replacing damaged tissues using stem cells or other approaches. So it's highly compatible with OCASCR's original mission. Today, our overall goal is to help adult stem cell and regenerative medicine research thrive in Oklahoma, with hopes that advances in scientific knowledge in these areas can be applied to alleviate suffering from smoking and obesity-related diseases in our state, including cancers, eye diseases, and heart diseases. So with this in mind, OCASCR has multiple missions related to adult stem cell and regenerative medicine research. Number one, it funds Oklahoma scientists interested in working in these areas by providing them with seed money that's intended to lead to bigger federal funding and breakthrough discoveries. Number two, it also funds applications for equipment that's critical for supporting stem cell and regenerative medicine research around the state. And it makes sure that that equipment is available to researchers at any Oklahoma institution. Number three, OCASCR helps Oklahoma institutions as they negotiate to recruit new scientists to the state with interests in adult stem cell biology and regenerative medicine. And our goal here is to grow the number of thought leaders in our state and to elevate Oklahoma's prominence at the cutting edge of biomedical research. Number four, OCASCR also hosts distinguished speakers from outside the state. And this too is meant to elevate Oklahoma's visibility and expand our scientists' network of advocates within the scientific community. And finally, number five, OCASCR serves as a trusted resource for public information. We field calls from the public about stem cell therapies, and we strive to provide hope to Oklahoma citizens while steering them away from participating in questionable medical treatments and trials, which are unfortunately abundant on the internet. So all of these endeavors are paying off. Over the years, our OCASCR scientists have leveraged about $25 million in TSET funds to secure more than $175 million in external funding, including $16.8 million in fiscal year 20. We know that these big dollars that largely come from federal investment are critical for pushing discoveries toward clinical practice. Our scientists are also publishing highly recognized and cited work with 73 publications emerging in fiscal year 20 alone. And OCASCR has been helping to recruit It's helped since it began to recruit more than 30 new scientists to the state, including 9 in fiscal year 20, and it has subsequently funded many of these scientists with our grants. And finally, our goal, like yours, is to support discoveries that positively impact the health of Oklahomans. And while much of the research that we fund supports early stage discoveries that do take many years to mature, we are excited about breakthroughs our scientists are making that are directly impacting Oklahomans right now. And these include the discovery of genetic mutations in 2 Oklahoma children that are leading toward the treatment of their skeletal disorders and similar disorders in patients around the world. So in conclusion, we are grateful for TSET's 10 years of continuous funding that has helped put Oklahoma on the map in terms of stem cell and regenerative medicine research. I know that OCASCR grants and networking opportunities are highly prized by the state's research community, and I'm confident that our scientists are making good use of TSET's investment as they make discoveries that provide the foundation for curing and alleviating diseases in Oklahoma. Thank you for your attention.
Thank you. Do we have any questions for Dr. Griffin? Okay, we will move on to Dr. Robert Mannell. He's the director of the Stevenson Cancer Center. He's the Rainbow Family Chair in Cancer, and he's the Associate Vice Provost for the Cancer Programs at the University of Oklahoma Health Sciences Center. Dr. Mannell.
Thank you, Jonas. It's a real pleasure to have an opportunity to spend a few minutes talking to the board. We did send a more extensive slide set with a voiceover, but I thought I'd pull out a few slides for us to go over. You know, cancer continues to be a big problem in Oklahoma, affecting 1 out of every 2 men and 1 out of every 3 women. We unfortunately rank 4th in the nation in cancer mortality. And so it's a big challenge for the health of Oklahoma. Next slide. In 2001, the state legislature called upon the University of Oklahoma to provide statewide leadership in cancer research, prevention, information, and treatment, and to become NCI designated cancer center, serving all the citizens of the state of Oklahoma. That was a very, very big task and a tall order. In order to achieve this goal, we needed partners. And I'm going to explain how incredibly important TSET's partnership with us has been. Next slide. Our vision is quite simple: to eliminate cancer in Oklahoma and beyond. And we want to do that through research-driven patient care, research within our labs, outreach into the community, and training the next generation of cancer care providers. Next slide. Our TSET funding started in January of 2012. It is a $5.5 million annual grant that was on a 5-year grant cycle. And of course, its purpose was to help create that vision of eliminating cancer in Oklahoma and beyond, and help us achieve and maintain NCI designation. The TSET research funding that we receive really supports these research-focused activities of recruitment, infrastructure, pilot funding, community outreach, and institutional collaborations. I have a few slides here to highlight. Right now, we have almost 300 members of the Stevenson Cancer Center, representing 9 organizations statewide. If you look at this list, it's quite impressive. 63 academic departments and 15 academic colleges coming together to address this problem of cancer in our society. Next slide. We recruited 64 new researchers to Oklahoma with TSET support. They brought with them almost $35 million in funding, but since being here, they've gained an additional $110 million in funding, with total extramural grant funding of $145 million and pharmaceutical industry contract funding of almost $80 million. If you look at a standard 3-to-1 economic impact ratio, that's almost $700 million, new dollars that have gone into the Oklahoma economy based upon this. And these researchers are at OU, Norman, OU Health Science Center, Oklahoma State, and OMRF. Next slide. This is our annual cancer-related funding, and I started it in 2013 because our grant with TSET started in 2012. And you can see we had a baseline funding of about $21 million annually. That is now over $60 million, a threefold increase in cancer-related funding here in the state of Oklahoma. And this is on our Health Science Center campus as well as on the Norman campus. Next slide. Talk about community impact. Probably the best way is with the incredible support that TSET has provided to our clinical trials network. TSET support has helped the SEC provide Oklahoma's access to promising new cancer therapies through clinical trial participation. And if you look at some of the highlights, over 7,500 patients have enrolled in clinical trials over the past 8 years. And that represents patients from all 77 Oklahoma counties. So this is a big part of a statewide research network. 47% of the patients treated on clinical trials were from outside Oklahoma and Cleveland counties. Once again, underscoring our commitment to all Oklahomans. We have a statewide clinical trials affiliate network, including places in Tulsa, Bartlesville, McAllister, Chickasha, Lawton, Duncan, and Altus. Next slide. We take great pride in the fact that we lead the nation in enrollment on National Clinical Trials Network. This is the largest clinical trials network dealing with cancer in the entire world. It's sponsored by the National Cancer Institute. It involves over 2,000 organizations, not only in the United States, but in Canada, Europe, and Asia. And for the past 5 years in a row, Oklahoma is ranked #1 in enrollment to this very critical clinical trials network. Next slide. I think I want to summarize this. TSET support has been the most important factor in #1, supporting the Stevenson Cancer Center's development into a nationally recognized cancer research and treatment center, and #2, helping the Stevenson Cancer Center achieve NCI designation. It's done this by enabling us to create great research partnerships, recruit new researchers. These dollars have been leveraged. They've brought in state dollars, institutional dollars, philanthropic dollars, and hospital dollars. All told, this has brought in new dollars to the economy of Oklahoma and has given patients great access to clinical trials, as well as anywhere in the world. TSET support has truly raised the standard of care for cancer patients throughout Oklahoma and has improved patient outcomes. And we look forward to continuing this journey as we strive towards the next level of designation for the National Cancer Institute, and that's called National Cancer Institute Comprehensive Cancer Center. That'll be based upon our showing that we are impacting the entire state of Oklahoma in a positive way, setting up partnerships, working with other healthcare delivery systems, meaningfully impacting cancer diagnosis and therapy throughout Oklahoma. Thank you once again.
Thank you, Dr. Mannell. Are there questions for Dr. Mannell? Okay.
All right. Now we will go to the discussion of the OSU Medical Authority Residency Program. Is that correct?
Yes.
Okay. Onos, I'll turn it back to you again. Thank you.
Okay. Okay. Thank you. I'll go through a summary and then I'll give Dr. William Pettit just a moment to offer comment. Dr. Pettit's the Dean of OSU Cherokee Nation campus. He's the professor of medicine. The summary, I believe, is on pages 29 through 31 of your packet. So there were meetings held last late fall, and then a proposal submitted in the early spring by the Oklahoma State Center for Health Sciences with regard to the Stillwater Medical Center. Of course, they've submitted a proposal to increase the number of rural health physicians by increasing the rural physician residency training opportunities. And what they seek is approval by the board of directors to make available the remaining balance, which is about $2,400,000 for a residency program that's going to span 3 years, 5 residents per year, or a total of 15 residents at the end of 3 years. The TSET funding, our funding, will pay for resident salaries and other expenses of the program. The match on this is roughly 61%. There's support from OSU of about 1.5 million, and then support by the Stillwater Medical Center of 2.2 million plus. And it's a 3-year program to be implemented starting July 1st, 2022. Of course, this year, 2023, this coming year, fiscal year 2022, will be a planning year. And at the end of that year, they'll submit an implementation plan for us to review. The table that is on pages 29 through 31, I think it's maybe page 30 or so, gives you an idea of how our money is going to be spent. In FY23, there'll be roughly $500,000. FY24 will move up to about 800,000, and then FY25 will be 1.1 million. It's in reviews, it's a very solid proposal, and it has in-kind match that's significant. They've provided us a work plan for this coming year, that I think we shared the proposal with you all, and so it's in that proposal. I'd like to turn it over to Dr. Pettit for just a few words, and then I'll hand it back to you, Michelle. Dr. Pettit?
Yes, thank you very much. Can you hear me okay? Great. I appreciate being here today. Happy to answer any questions. Mr. Mata has described our program, I think, succinctly. This is based on the Medicare cost reimbursement model. So as the 3 years go by, Stillwater Medical Center will gain reimbursement from Medicare for this program. So at the end of the 3 years, with your help of getting the program started, they'll have their highest level of Medicare cost reimbursement to sustain the program. They're excited about it. I've met with the chairman of their board, and things are moving fine. Matter of fact, today, as we speak, the Accreditation Council of Graduate Medical Education Internal Medicine Review Committee is conducting the initial site visit with Dr. Stephen Cummings, MD, who's going to be the program director there. We're very excited about this, and of course, it's still considered a rural program in Stillwater. And we, of course, very glad to see one of our programs supported by TSET in OSU community. So Mr. Mott asked me just to say a few words, and then I would open it up to any questions if you have any.
Does anyone have any questions? All right, I will entertain a motion on any possible action on the OSU Medical Authority Residency Training Program.
So moved.
Second.
Motion's been made by, I believe that was Jack, and seconded by Marshall. Is that correct? Okay.
Yes.
Roll call, please.
Michelle Stevens,
Yes.
Bruce Benjamin,
Abstain.
Jack Allen,
Yes.
Casey Kilblain,
Yes.
Susanna Gattoni,
Yes.
Ken Rowe,
Yes.
Marshall Snipes.
Yes.
Motion passes.
Jack needs to turn on his camera to vote.
My camera's not on? Oh,
It is not. There you
is it
are.
on? Is it on now? I thought it was on. Sorry. Okay, yes.
Thank you.
All right, motion carried. I will turn it over to Tessa North for an update on our Oklahoma Tobacco Helpline.
Great, thank you, Michelle. We have 2 funding renewal requests for the helpline today. The first of the 2 requests is for Oklahoma Tobacco Helpline Services, which are provided to Oklahomans statewide. Just as a brief update for the board, in FY21, OUHSC issued an RFP for helpline services. A TSET staff member served on the review committee, and there were 3 other review members as well. After all responsive proposals have been reviewed and scored, Optum, who currently operates the helpline via a subcontract with OUHSC, was selected as the vendor and was subsequently approved by the OU Board of Regents to be awarded the contract. So for FY22, TSET's requesting $4 million for OUHSC to provide cessation services to Oklahoma tobacco users through the helpline operated via this subcontract with Optum. The helpline, which provides text, email, and phone options for callers, reaches a large segment of Oklahoma's population that are tobacco users with an array of cessation services. In FY20, 28,547 tobacco users were registered for support through the helpline, and if approved, the funding amount for FY22 would allow the helpline to serve up to 40,000 callers annually. So that's the first recommendation for the board to consider. The second funding request is for $349,015 for OUHSC faculty and staff to provide oversight of the helpline services. So this is a separate contract that allows local staff to oversee the daily operations of the helpline and provide technical support to users, as well as to TSET Health Systems Initiative grantees. Oversight staff will collaborate with the TSET Health Promotion Research Center, which is formerly OTRC, as you guys all are aware, to support a postdoc to develop research opportunities between the Hprc and the helpline. The oversight funding agreement also provides continued funding to partially support the Oklahoma City and Tulsa 211 call lines and to promote TSET's youth cessation program, My Life, My Quit. So that's a brief overview of the 2 funding renewals that are requested today. And then I believe Dr. John Hart is on the call if anybody has any more detailed questions about the RFP process or anything related to any of the contracts. I think he would be happy to answer any questions that I can't answer for you guys.
Does the board have any questions for Dr. Hart or Tessa North before we vote on these individually?
I have a question for Julie.
Okay.
Why are we voting on this today instead of next month as part of the budget process?
Yeah, good question. It is different. What is important is that since the regents enter into a contract, that they are aware that the funder of these services, which would be TSET, has plans to fund this going forward. We have talked with Dr. Hart about looking at the process for next year, but this has been the practice that we've done. So that allows OU to move forward with their procurement process so that there is not a break in services. And Dr. Hart, is there anything more you would add to that? He says no.
No, nothing additional. I mean, that captures, I think, why it's done historically, but go ahead.
Yeah, I still don't like approving budgeted items outside of the context of the overall budget. Now, having said that, it looks like we're going to be just fine, and I'm in favor of the program. I just don't like the process we're going through here to do things outside of the budget, normal budget process. So I'm going to go ahead and vote for it today because I'm comfortable that we're going to have the money to fund this, but I sure would like for us in the future to look at keeping everything in the context of the budget. And if that means we need to move the timing of the budget up to accommodate people like Dr. Hart, then I would be much more comfortable.
Okay.
Are
Yeah,
there
that
other,
my
are there other
recommendation.
comments?
Yeah, that would be my recommendation, is that we just plan to have our budget cycle earlier, because I'm sure it affects other agencies and whatnot.
Any more discussion? All right, I will entertain a motion on the first agreement, the University of Oklahoma Health Sciences Center, Oklahoma Tobacco Helpline Services.
The amount of that again?
Move to approve.
Second.
The motion has been made and seconded. Please call the roll.
Michelle Stevens,
Yes.
Bruce Benjamin,
Yes.
Jack Allen,
Yes.
Casey Kilblain,
Yes.
Susanna Gattoni,
Same.
Ken Rowe,
Yes.
Marshall Snipes.
Yes.
Can we clarify that amount again? Should that be in the motion?
For Helpline Services, the committee recommended 4 million, and that was what we were requesting. And then for the oversight, 349,015.
Thank you.
I'll entertain a motion on the University of Oklahoma Health Sciences Center, Oklahoma Tobacco Helpline Oversight for the amount of 349,015.
So moved.
Second.
Motion's been made by Casey, seconded by Bruce. Please call the roll.
Michelle Stevens,
Yes.
Bruce Benjamin,
Yes.
Jack Allen,
Yes.
Casey Kilblain,
Yes.
Susanna Gattoni,
Same.
Ken Rowe,
Yes.
Marshall Snipes.
Yes.
All right, discussion and possible action on healthy incentive grants for the districts. The Programs Committee recommends the following districts for funding of the healthy incentive grants. We have those listed. Who is
Yeah,
One
and
is-
I can go ahead and read that because we may have some people that are audio only join in on any one of
Okay.
our online streams. So I'll just go ahead and read that, and then you all will need to motion and vote. So discussion and possible action on healthy incentive grants for districts. Cave Springs, $15,000. Whitefield Public School, $3,000. Newcastle Public Schools, $7,000. Glencoe Public Schools, $8,000. Marietta Public Schools, $14,000. Maud Public Schools, $12,000. Battiest Public Schools, $12,000. Kingston Public Schools, $20,000. Howe Public Schools, $11,500. Darlington Public School, $8,000. Oktahah Public Schools, $20,000. Heavener Public Schools, $20,000. Glover Public Schools, $15,000, for a total recommended award of $165,500 for healthy incentive grants for school districts.
I'll entertain a motion regarding these incentive grants.
Move to approve.
Second.
Motion's been made by Bruce, seconded by Jack. Roll call, please.
Michelle Stevens,
Yes.
Bruce Benjamin,
Yes.
Jack Allen,
Yes.
Casey Kilblain,
Yes.
Susanna Gattoni,
Yes.
Ken Rowe,
Yes.
Marshall Snipes.
Yes.
Julie, will you read the next list for us, please?
Sure. So discussion and possible action on healthy incentive grants for schools. Jay Elementary School, Whale Creek Elementary, Will Rogers Elementary, that's in Payne County, not in Oklahoma City. There are two. Stillwater Middle School, 5,000. Westville Public Schools, 6,000. Ravia Public School, 2,000. Comanche Middle School, 2,000. Allen Elementary, 3,000. Waurika High Middle School, 3,000. Bennington High School, 2,000. Porter Junior and High School, 4,500. Porter Elementary School, 4,500. Bennington Elementary, 3,000, for a total recommended award of 47,000 for healthy incentive grants for schools, school sites versus school district.
I will entertain a motion regarding these healthy incentive grants for the schools.
So moved.
Second.
Motion's been made by Jack, seconded by Casey. Roll call, please.
Michelle Stevens,
Yes.
Bruce Benjamin,
Yes.
Jack Allen,
Yes.
Casey Kilblain,
Yes.
Susanna Gattoni,
Yes.
Ken Rowe,
Yes.
Marshall Snipes.
Yes.
Motion
All right.
carries.
Discussion.
Michelle, question. Could we get an overall number of how many school districts, since we started doing this, I mean, can we gather that number? How many we've actually granted to and the total dollars granted?
Yes, we can get you that number. Total number of schools and school districts and the total amount.
Interesting. Yeah, it'd just be, and then also how many actual school districts, kind of looking for the percentage that we've actually been able to fund total districts versus how many we have, or how many we have versus total districts.
Yes, we can get you that information.
That's a very good question.
I have them occasionally. Not often.
Along those lines, since some of these are more than one school per district getting those grants, how they'll explain, I guess, how that is reported to us. Okay, so one more set, discussion and possible action on healthy incentive grants for communities. Julie, I'll let you read those, please.
Great. City of Guthrie, 70,000. Town of Kearney, 14,000. Town of Meeker, 14,000. City of Miami, 24,000. Town of Central High, 10,000. City of Perry, 25,000. City of Anadarko, 10,000. City of Yale, 10,000. Town of Talala, 10,000. City of Comanche, 36,000, for a total recommended award amount of $223,000 for incentive grants for communities.
I will entertain a motion for the healthy incentive grants for the communities.
So moved.
Second.
Motion's been made and seconded. Casey and Bruce, roll call, please.
Michelle Stevens,
Yes.
Bruce Benjamin,
Yes.
Jack Allen,
Yes.
Casey Kilblain,
Yes.
Susanna Gattoni,
Yes.
Ken Rowe,
Yes.
Marshall Snipes.
Yes.
And
Motion
just for the board's awareness, there will be a third cycle. We still have money available in these grants, which are first come, first serve. And so we will be opening that up in April.
For communities and schools?
I believe so.
Julie, I will turn it over to you for the Food Systems Impact Grants report.
Great, thank you. If you'll recall, about a year ago this time, we were all in the midst of trying to figure out what COVID-19 pandemic meant for us individually and our jobs. And one of the things that this board did was to look at grants that we knew were not going to spend all of their dollars and capture some of that lapse, and created a category for funding for food systems impact grants. We know that food insecurity increased and continues to be high during the COVID pandemic and economic disruption. And so these were one-year grants with a total amount of $1 million over 7 different grantees. And so we are now at the 6-month mark of these grants, and we've had a chance to visit with them and wanted to give you a few highlights. They, of course, will be doing final reports for us as well at the end of their contract, which will be in September. The grantees are Boys and Girls Club of Ottawa County, Hunger Free Oklahoma, Urban Strategies, Regional Food Bank of Oklahoma, RSVP Enid, Harper County Development Authority, and Gateway to Prevention and Recovery. And these grants were awarded through a competitive process. And so they came to us and told us their projects and how they would propose to spend those dollars. Boys and Girls Club of Ottawa County was able to purchase a stove and turn their kitchen into a commercial grade kitchen, which allowed them to meet the need for increased meals. They've served 25,271 meals since September 20th. That's up during the same period last year. And of the 156 kids served from September to March, 32% come from single parent households and 78% qualify for free and reduced lunch. So they will continue to make progress and partnerships to meet that need. Hunger Free Oklahoma, if you recall, their project was the expansion of Double Up incentives. That's an incentive that people on food stamps can get to increase access to fruits and vegetables. It's a program that's been around a while, but Oklahoma is one of a handful of states that are doing it, basically allowing increased buying power. And so Hunger Free Oklahoma has wrapped up their pilot at the Okemah Homeland. Homeland has also been a partner in this, as well as several private funders. And at that pilot, they saw a 23% redemption rate, or about $3,000 a week, which is 13 points higher than comparable program rates and national averages. And what they are piloting is a change in the point of sale, or basically your checkout system, that allows these Double Up incentive dollars to be used in a grocery store. Typically, they have been used at farmers markets. And so again, increasing access. The next phase of this project will include expansion to Homeland stores in Jay, Altus, and Bartlesville, as well as health marketing and outreach. They recently had a site visit from a National Nutrition Intervention Technical Assistance Evaluation Center, where they were informed that they are the only organization in the country working on a uniform incentive system that could be deployed across all grocery chains. So looking for some additional information and really looking forward to the evaluation that they will be able to present, and that is potentially something that could be used statewide and also addressing these needs across the nation. Urban Strategies is working in Tulsa River West, Eugene Field community. And their goal of the program is to support low-income residents as the neighborhood there is being redone and some of the housing has been reworked. After securing the TSET grant, they are moving forward with the expansion of food access and health literacy for the individuals, approximately 1,000 people. They are doing mobile-based trainings. They are doing incentives, which also dovetail with the Double Up bucks, trying to support residents of those neighborhoods and also increase their awareness about fruit and vegetable consumption. We've also seen some nice opportunities for partnership with Shape Your Future as well, getting those resources, and the Oklahoma Tobacco Helpline. Our other grant is the Regional Food Bank of Oklahoma. This project was to expand the senior servings program. This was something that really, was coming to fruition as we were seeing some of our senior citizens not getting out as much. And during September through December, regional food bank really looked at the barriers and the needs, the specific needs of seniors, whether that be limited physical strength to open things with a can opener, or the need for low salt foods, and they have accommodated and changed the types of things that are available, the takeaway food. To date, 2,029 meals have been distributed, and the program continues to add partners as their goal towards making this available to more seniors. They're also working with the Oklahoma City Housing Authority on a brick and mortar certified healthy senior pantry. So again, taking those services where seniors are and helping them have more healthy options. And then RSVP of ENID, increasing mobile meal programs for seniors. During this last 6 months, RSVP of ENID has seen a 38% increase in demand for services. And as some of you may know, mobile meals is typically a hub. So they're going into someone's home, providing them a meal, but they're also able to assess if other services. And what their director was reporting to us was that, they were also then able to connect residents, seniors to mental health counseling as they were going through that isolation before there was a vaccine and before that was widespread. It's estimated that RSVP ENID serves 1,000 seniors in a Western County service area in a variety of ways, and also continues to have volunteers. They are also working to increase enrollment of SNAP where it is applicable. But again, that hub for a section of the community that we know really has been impacted by COVID. The Harper County Development Authority, working in Laverne, they've worked on a brand called Connected Roots. It's a kind of a food co-op where they're connecting local farmers, gardeners, producers to a storefront under that Connected Roots, creating community buy-in around local food. They are also, with our funds, able to support a coordinator who is helping to work with the farmers market there to improve the overall experience and organization, and get the word out about the farmers market, and also looking to see if there are ways to accept SNAP food stamps at the farmers market. That's an interesting project, as it's also brought together some of the economic development champions in their community to talk about what are we doing out here, what are we producing, and how can we get that to more people. They're also looking to work with their local governmental entities on a food policy council. And then Gateway to Prevention and Recovery was working on mobile food market to serve rural areas of Seminole, Pottawatomie, and Hughes counties, some of our top priority counties. And as COVID may have limited some of their abilities to get out and have the community meetings, they have seen high demand for the mobile food market offerings and continue to make strides towards that, working to meet the needs. I know their director said that they were seeing new people in some of the services that they were offering, and people coming from other counties to get this. So definitely there is a need that they are meeting. And so I will take any questions that you may have. Again, this is just kind of the 6-month check-in, and wanted to give you guys an update on that.
Do you have any questions for Julie?
Julie, a quick question. Several of them in their write-ups, they say if additional funding is this, I don't remember seeing it in the budget for next year. Are we looking at continuing this, or was this a one-time?
This particular funding opportunity was a 1-year opportunity. That is a question that we do ask them in our calls, just to see, what plans they would have for the future. And so that is a decision that this board will likely be tasked with making in May or August. We do have a placeholder, but it is, of course, just a placeholder, and it would require a board decision.
Any other questions? All right, I'll turn it over to Ken for public information and outreach report. I think he's here.
was.
Let's see.
Maybe he'll come back to us.
We flipped a coin and he lost, so he was supposed to do this today. So
Okay.
obviously,
Rock,
I
paper,
guess
scissors.
if just are quiet, then it doesn't matter, right? Okay.
Sounds to me like he won.
Yeah, I was gonna say, yeah, I should learn to be quiet. So anyway, all right, we'll jump in on this. Mainly, we're gonna ask Sana to kind of take us through most of it and give us our updates. Just some really exciting things that are coming around. So Sana, I'll turn it over to you for update on our Shape Your Future and Tobacco Stops With Me.
Okay, and can everyone hear me?
Yeah.
Okay, wonderful, just checking. This first report starts on page 43 in your packet. I wanted to let the board know that Shape Your Future and Tobacco Stops With Me won 4 bronze and 2 silver Addy Awards from the American Advertising Association Oklahoma chapter. Several of the silver placements will move on to regional competition, and we'll let you know how they do. All brands, Shape Your Future, Tobacco Stops With Me, and Oklahoma Tobacco Helpline are performing to our plans, and our planning for fiscal year 22 is underway. Tobacco Stops With Me has launched Facebook frames, which Oklahomans can add to their profile photos to show support for tobacco-free lifestyles. Shape Your Future and I Quit frames from the Oklahoma Tobacco Helpline will be coming shortly. And currently, the Tobacco Stops With Me cross-sectional survey is in the field, and the instrument for Shape Your Future is being finalized and will be in the field in late spring. There's much more additional information on page 43 through 51 in your packet. Does anyone have any questions? Casey, would you like me to go on to the Public Health Academy of Oklahoma?
Perfect, thank you.
Okay. That's our peer-to-peer training system, also known as OK in the Know. We're seeing an average of 110 unique grantee users per month, which is awesome. We've seen more than 120% increase in the grantee forum interaction since January 2021 over the same time last year. And we've added 4 new trainings in January with a schedule full for the rest of this year and starting next year to have uploaded as well. And you'll find that on page 52 through 53 in your packet.
Thank you. The next item is our COVID-19 Mask Up Final Report. You recall we were asked to help promote this, just some of the highlights of that. Sana, if you want to walk through those things, I think we hit the targets and beyond.
Yes, we did. We were really pleased with how we were able to turn that request around very quickly and get it out over the holidays in early January or in January to help Oklahomans remember to mask up when they go out, keep themselves and others safe. You'll find this in your packet on page 54 through 61 with maps on coverage. The TSET OSDH COVID campaign had traditional media coverage in 75 of our 77 counties. The Mask Up campaign achieved an 80% video completion rate, meaning that 80% of the users who were served the ad chose to watch it in its entirety. This performance accounts for about 14% increase from our normal KPI of a 70% video completion. So our target was 70% and we got 80%. The Mask Up digital campaign reached 2,991,889 unique devices in Oklahoma. And unique devices doesn't mean unique individuals, because many of us can have a tablet and a phone or a computer and a phone, that type of thing. But nearly 3 million unique devices were hit with the message. So we're excited about that. That's a pretty good coverage. We received an estimated 231,000 in unique bonus spots, with 16,599 total bonus spots delivered. And more than 55.8 million traditional impressions were delivered statewide. The digital video campaign had an excellent statewide presence with video completion rates above the KPI throughout the state's regions. And you can see a breakdown of top cities in the report document as well.
Very nice, thank you. Now we'll move into our TSET Healthy Youth Initiative with an update. Public health education messaging with Rescue. Sana, do you have that, or do we have somebody
Yes.
from Rescue?
Nope, I've got that. And it's on page 62 in your packet. We completed a digital and social promotion December through February of the My Life, My Quit free cessation resources for youth. We'll have a final report for you in May. We did not have it quite completed for this month. We were lacking a little bit of data. We're finalizing 2 more nutrition messages, which will be launched in May. And you will be receiving a sneak peek of video cuts of those right after the board meeting. And Beyond the Haze and Down and Dirty vaping and smokeless messaging will begin on TV cable in April, and you'll also receive links for those. And the public will be able to see those on our swapupok.com website and at the healthyyouth.com website. Planning for the next fiscal year has begun for anti-vaping and health nutrition messaging, with evaluation data to be collected during this summer for the end of our first year of this program.
That's awesome. That is good. Okay. Any questions on the youth initiative for Sana or Hanas or anyone? Any questions? Going once?
Just a comment. It just looks like we've done some wonderful work here, and I'm very proud of this board for really taking on the youth initiative.
Yeah, it's really exciting. I'm thrilled. I think it's very proactive on our part. So, okay. We've got our legislative update now, and I think Thomas has got that for us.
Yes.
Our favorite of the year.
All right. So the legislative session started the 1st of February. Lauren and I have been following bills. I'll just hit the highlights. You have a full legislative update in your board packet. But as for TSET related bills, SJR 13 and SB 922, which would have affected new monies going into the trust, those did not get heard in committee. So those are effectively dead for this session. Other bills that have fallen by the wayside, House Bill 1114 by Representative Rick West, that would have allowed smoking back into Oklahoma prisons. That was voted down in the House of Representatives. So that issue is dead for the rest of this session and next session as well. There were a couple of bills that would have created a tax on vaping products. Those have all failed to meet deadlines this session, so they won't be moving forward. Lauren and I have put a lot of our energy in the last few weeks behind Senate Bill 89, which would ensure that students in Oklahoma get public education. So it's a health education bill in Oklahoma, and I got word that it just passed out of a House committee a few minutes ago. So it will next be heard on the House floor, and if the House approves it, it would go to the governor. There are a couple other bills dealing with tax stamps and definition bills that we have been monitoring, but aren't receiving a whole lot of attention right now. But we are talking to legislators about those. And that is most of the legislative report. I will answer any questions.
Okay. If you want to continue on with public information and outreach, Thomas?
Yes. So on March 7th, TSET published an article in the Oklahoman's Brand Insight section about the TSET food impact grants that were awarded last year. You just heard an update from Julie on that. TSET hosted a webinar for grantees and partners to identify and explain bills this legislative session and connecting those bills to TSET's mission and its programs. TSET staff continues to meet with legislators to discuss bills related to our mission, its work as a state agency, and we're also having meetings about the Loft inquiry. We've been sending letters to inform legislators about recent grants in their districts, and updated local impact pages have been posted on the TSET website. Those are the pages that show TSET's impact in every county, House district, and Senate district in the state. The second flight of TSET's paid media campaign began January 25th with social and digital messages focusing on TSET's work in preventative health measures, resources, and education. Those messages inform the public about unhealthy behaviors that can lead to disease and death, and about the TSET programs that are helping to change those behaviors to improve health in Oklahoma. We have also published the FY20 annual report, and that is now available on the TSET website. For the sponsorship grants, the most recent sponsorship grants were awarded to the Indian Nations Council of Governments for a conference on health inequality. And we also awarded a sponsorship grant to the Muskogee Parks and Recreation Department for the Muskogee Senior Games. So far, we've spent $11,250 or 46.88% of the 20. Yes?
Go ahead. Sorry, I was laughing.
Okay, of the 24,000 sponsorship budget. Of course, we cut that budget back a little bit this year, but with the pandemic and COVID, there has not been a lot of demand for conferences and sponsorship grants. Upcoming events and trainings, there's a list in your board packet. Those include the Tribal Public Health Conference, April 20th through 22nd, the Oklahoma Osteopathic Association virtual meeting, April 23rd through 25th, and the Grant Makers in Health Conference on June 8th.
Okay. I think that concludes our report, Michelle.
All right, thank you, Casey. Okay, we'll go to agenda item number 7, appointment of epidemiologist and program officer. I will entertain a motion and vote to enter into executive session pursuant to 25 OS 307B1 for discussion of employment of any individual salaried public officer or employee.
So moved.
Second.
Motion's been made by Casey, seconded by Jack. Roll call, please.
Michelle Stevens,
Yes.
Bruce Benjamin,
Bruce, you're on mute.
Yes.
Jack Allen,
Yes.
Casey Kilblain,
Yes.
Susanna Gattoni,
Yes.
Ken Rowe,
Yes.
Marshall Snipes.
Yes.
Motion carries.
Okay, remind me how we do this again.
So give me just a few seconds and I will move the board members and Julie into a breakout room.
Okay.
Oh, cool. So we don't have to.
Just hold on for the ride.
Okay.
Go, Thomas.
Go, Thomas. Go, Thomas. No pressure. No pressure.
Hurry up. Hurry up.
Here you go. You should have just gotten an invitation to join the breakout room. Julie, you're back.
Yes, sorry. I'm back. They will continue to be an executive session as they have the evaluation on the agenda. So they are having
Okay.
conversation. So many things to turn on and click through, and
Yes.
multitasking Zoom fun. So if they have trouble coming out of the breakout, they'll text me and we can adjust.
Okay. Yeah, if they have trouble coming out, I can just end the breakout room.
Okay. All right.
Are we all coming back in?
I am back. See Susanna, Casey, Marshall, Bruce,
Yep.
Ken. Okay,
Made it.
we made it. I will entertain a motion to come out of executive session and return to open session.
So moved?
Second.
Motion has been made by Casey, seconded by Bruce. Please call the roll.
Michelle Stevens,
Yes.
Bruce Benjamin,
Yes.
Jack Allen.
Oh, Jack had to leave.
Okay. Casey Kilblane,
Yes.
Susanna Gattoni,
Yes.
Ken Rowe,
Yes.
Marshall Snipes.
Is-
Marshall, you're muted.
Sorry about that. Yes.
Thank you.
We are back in open session. I will entertain a motion regarding the employment of a program officer.
Yes, we are recommending to direct the Director of Programs to make an offer of employment to Program Officer Candidate A at an annual salary of $57,000.
Do I hear a
So moved?
Second.
motion's been made by Casey, seconded by Bruce? Please call the roll.
Michelle Stevens,
Yes.
Bruce Benjamin,
Yes.
Casey Kilblane,
Yes.
Susanna Gattoni,
Yes.
Ken Rowe,
Yes.
Marshall Snipes.
Yes.
Julie will ask you to recommend on the epidemiologist.
Yes, recommending the Director of Programs make an offer of employment to Candidate A at an annual salary, Candidate A for epidemiologist, at an annual salary of $62,000.
Move to approve.
Second?
Approval by Bruce, seconded by Casey. Please call the roll.
Michelle Stevens,
Yes.
Bruce Benjamin,
Yes.
Casey Kilblane,
Yes.
Susanna Gattoni,
Yes.
Ken Rowe,
Yes.
Marshall Snipes.
Yes.
All right, Bruce, will you talk to us about the annual evaluation of the executive director and our recommendation to approve? I guess you don't have to. I can just state it. The annual evaluation of the executive director, I open it up for a motion to approve that.
So moved.
Second?
Motion's been made by Bruce, seconded by Casey. Please call the roll.
Michelle Stevens,
Yes.
Bruce Benjamin,
Yes.
Casey Kilblane,
Yes.
Susanna Gattoni,
Yes.
Ken Rowe,
Yes.
Marshall Snipes.
Yes.
All right, is there any new business? If not, I will entertain a motion to adjourn.
So moved? Why not?
Second.
Motion's been made by Casey, seconded by Bruce, correct?
It's correct.
Okay, roll call, please.
Michelle Stevens,
Yes.
Bruce Benjamin,
Yes. Yes.
Casey Kilblane,
Yes.
Susanna Gattoni,
Yes.
Ken Rowe,
Yes.
Marshall Snipes.